when you look at treatment decisions, we all look at statistics, survival, chances of reoccurrence. But remember, statistics are measures of group trends. They don't say what's going to happen to you as an individual. So use the statistics, but once you've made a decision, remember there's only one statistic that matters. That's the statistic of one. That's the statistic of you. And then once you've made a decision, don't look back. As long as you're comfortable with that decision. Because whatever happens, it doesn't matter because you can't undo it. What's important is to look forward and say, I have this side effect, this did work, this didn't work. There's no reason to say, I should have spent more time making a decision, I didn't make a good decision, because as I've suggested, you've taken time to make that good decision. Find the right doctor. For men with metastatic or advanced prostate cancer, they should move from their urologist to a medical oncologist, but find a medical oncologist who specializes in the treatment of prostate cancer. A general medical oncologist or oncologist who treats 15 different cancers is not going to be as cutting edge, specific to your disease, as will somebody who specializes in it. Go to the best possible healthcare facility. But when you go to meet these doctors, and you should interview your doctors before you decide on a doctor, remember that being a doctor in today's world is big business. And there are some doctors who allow the big business aspect to take too much of a part of what they suggest. So always have a little cynicism in anything they tell you. Ask questions again, and then even ask more questions. That's your right, it's your obligation. Figure out after you meet with the doctor and ask these questions, can they allow you to be an active member of the team? How are you going to communicate with this doctor when you see them face to face at a meeting? And more importantly, when you're at home and you have a question or a problem, will they respond to you by email if that's what you want? Will they call back? What is their policies? These are really important. You want to find a doctor who is going to be who's going to use a system that you're comfortable with.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed. But right now, a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.